Hey, Phelan-McDermid Syndrome Foundation community. I'm very excited today to have three outstanding guests on our podcast who are here to talk about advocacy and policy. Over the past month or two, the Phelan-McDermid Syndrome Foundation has been hosting various calls to action and action alerts on our social media accounts to really draw attention to some of the proposed changes at the federal level that may directly impact the Phelan-McDermid Syndrome community. Thus, PMSF is working with our key advocacy partners to keep our community educated and updated. We have three of those advocacy partners to keep our community in the know. Today, we have Samantha von Felden, the Vice President of Advocacy from the EveryLife Foundation for Rare Diseases. We have Mark Vieth, Senior Vice President from CRD Associates, and we have Katie Collins from G2G Consulting. Welcome, Shannon, Mark, and Katie. Thank you so much for joining.
Welcome.
Thanks for having us.
Yeah, thank you.
Of course. So because we have three guests, which is particularly special in our podcast series, could you please each introduce yourself and tell us briefly kind of what you do in this advocacy space? Shannon, why don't you go first?
Great. Yeah, happy to. Like Lauren said, I am Shannon, and I work with the EveryLife Foundation for Rare Diseases. And specifically, I get to work on the Rare Disease Legislative Advocates Program, where I work with patients and family members and community members in the rare disease community across the country on their advocacy effort. And RDLA gets to provide opportunities, resources, trainings for rare disease patients and community members who want to get more involved in advocacy and use their voices to impact change for the rare disease community.
Wonderful. Thanks so much, Shannon. Mark.
Yeah, hello, everybody. I'm Mark Vieth. My experience in the rare disease community goes back quite a ways. I've been working for more than 20 years with various rare disease patient advocacy groups. I provide federal government relations consulting services, which includes lobbying, but also really, I think, more focuses on how to help these organizations be advocates for themselves when they meet with their members of Congress. So I've worked with my longest standing client is the Tuberous Sclerosis Complex Alliance, the TSC. And I also work with HHT, which is a rare blood vessel disorder. But I also wear another hat. I'm the coordinator of the Defense Health Research Consortium, which advocates for the congressionally directed medical research program at the Department of Defense. And I can talk more about that later.
Wonderful. We'll definitely pick your brain there. And Katie.
Hi, everybody. I'm Katie Collins. I'm a vice president at G2G Consulting, and I started my work in rare disease mostly in the cancer space. I was part of the original iteration of the cancer moonshot back during the Obama White House, and later when I switched to the consulting side, was very involved in rare cancer and educating government about the need for more attention for rare cancers, funding for rare cancers, and have since expanded and am working in the epilepsy and seizure fields in that same way. And so have been working with the rare epilepsy community on raising awareness in Congress about, again, the need for more attention for epilepsy and rare epilepsies and more funding and government efforts overall. So I'm really excited to be here. Thanks for having me.
Of course. Wonderful. So, to the community listening, we have three wonderful powerhouses here, sort of all coming in with a little bit different lenses. And while, none of them are necessarily tied directly to the Phelan-McDermid syndrome community, all of their work is really going to benefit that. So this first part of the podcast, I'd really like to start focusing on sort of helping educate our listeners on the current pertinent issues that may directly or indirectly impact the care of individuals with Phelan-McDermid syndrome, as well as the research in this disorder. And then secondly, I hope we can really shift and really talking about that empower piece to really help our advocates advocate for themselves and the causes they believe in. So let's start with that educate piece. Can someone give us a kind of a brief rundown of some of the current bills, executive orders, or policy changes that you guys have been watching most closely in this rare disease space?
I think most importantly for this audience, as we start to dive into some complicated policy issues that can be complicated for those of us who live and breathe this, that as family members and patients, you don't have to be an expert on these issues. I think that just to kickstart, there's no need to feel like you need to know every little detail or be an expert on any of these. You're an expert on your story, and that's what members of Congress really want to hear. But it is important to know what's going on and how that impacts your community. One really important thing for the rare disease community that we talked a lot about at Rare Disease Week in February are the changes that are happening to our federal agencies and their impact on rare disease patients, on medical research. Most recently, looking at those staff cuts to agencies like the National Institutes of Health, the Centers of Disease Control and Prevention, the Food and Drug Administration, and how those are really impacting rare disease programs. There are surveillance and data gathering programs at CDC that we're still trying to learn what the full impacts of those staff cuts are on those programs, for instance. They've said that FDA drug reviews won't be impacted by any staff cuts, but we're still trying to obviously figure out what those impacts really are. So I'd say that's one issue that we're really working on. We're also working on the reauthorization of the Pediatric Rare Disease Priority Review Voucher Program, which provides incentives for the development of pediatric rare disease treatments. And then, of course, understanding what the proposed budget cuts are, especially as they pertain to Medicaid, and what type of services might be impacted, and those services for patients might be impacted by those budget cuts. And then, of course, there's that yearly appropriations cycle. We have finished the continuing resolution for this year. Now we get to start for funding for FY 2026, which starts in September 30th, and what that's going to look like and how we as the rare disease community can make sure that our priorities are reflected in that process.
Thanks so much, Shannon. And I think one of the things that I do want to reiterate that I love that you pointed out first is that the community doesn't need to be experts in everything. It's impossible probably to. And so I think especially, during the second half of this, really kind of focusing in on like, what's that one or two things that you kind of hold really dear to your heart and might impact you guys the most to pick out. The other thing I think that you aptly point out is that we still don't know exactly what the impact of all of these things. Like, for example, the staff agency cuts. We don't know exactly what those to NIH or FDA or CDC might do. And so that's why we are so reliant on kind of our advocacy partners to really kind of keep us updated. I know you gave a lot, but I would love to give Mark or Katie an opportunity to put any other things on our radar that haven't been mentioned yet.
I'd be happy to jump in next. And certainly I'm tracking all the things that Shannon mentioned. But what I can talk about briefly is medical research, biomedical research. I cover the Congressionally Directed Medical Research Program, CDMRP, a great 5-letter acronym. This is a $1.5 billion budget within the Department of Defense, and Congress adds this funding every year to the defense appropriations bills. And it's for 35 programs, many of which are most of which are disease specific. So for example, there's an epilepsy program, autism, tuberous sclerosis, neurofibromatosis. Congress, when they passed the long-term continuing resolution to prevent the government from shutting down, they exacted a 57% cut to these programs. And that wasn't proportional across all 35 programs. A lot of these programs received zero funding because of this 57% cut. So for example, the autism program, $0. Epilepsy, $0. TSC, neurofibromatosis, all those programs were zeroed out for fiscal year 25. So this has been a year like no other.
Yeah. Thanks for sharing that. I appreciate you putting out some of those specific cuts. I know in the past, the DoD Autism Research Program has funded at least one or two Shank grants in the past. And so that is a bummer to hear. Katie, anything else we've missed?
I guess I'll try to end with some positive things that are happening. It's being on the Hill. It was really important that we talk about these concerns. Whether it's Medicaid, the CDMRP cuts, those are all super important. But then I also want to acknowledge some of the positive things that are going on. We have really wonderful champions in Congress for the Rare Disease Congressional Caucus who are fighting for these issues. So that's wonderful, and will continue to be voices of support. And then I wanted to talk. I know seizures are something that impacts this community, so I wanted to talk just a little bit about our excitement for the National Plan for Epilepsy and Seizure Disorders Act, which was introduced in February in both the House and the Senate, bipartisan, bicameral bills that we're really excited about. We're building support. We're starting to see sign-ons, and this bill would direct the HHS secretary to develop a coordinated national strategy for patients with epilepsy and seizures.
That's great. And we love some positive news.
Sure.
I guess I'd love to hear a little bit more about like what's entailed in a national plan for epilepsy, for example. What does that look like?
Yeah, sure. So we've seen the national plan model used in other diseases and other neurological conditions. Alzheimer's, the National Plan for Alzheimer's is several decades old. We've seen huge progress, both in how we talk about Alzheimer's, the level of attention that Alzheimer's gets from our government, the level of funding that Alzheimer's gets. And then, more recently, last summer, the Parkinson's community successfully advocated for and Congress passed a national plan for Parkinson's. So what it does is it really brings the different government entities that touch epilepsy and seizures together to have a coordinated approach to innovating in the space, to making progress for patients. Coming from the Cancer Moonshot, I've really had firsthand experience seeing what happens when you bring top level officials from all of these different places together to work in a coordinated manner to drive progress. It really moves things forward. It brings increased attention. It can help bring increased funding. And epilepsy and seizures is something that hasn't been talked about a lot. Epilepsy affects 1 in 26, seizures 1 in 10. So while there are certainly many different rare forms of epilepsy, seizures themselves are not uncommon, and we really need to be doing more.
Right. And yeah, we have, the stats in Phelan-McDermid syndrome kind of range anywhere from like 10 to 70%. And so it's a wide range, and we're still haven't sort of narrowed that down. Hopefully our natural history study, which is funded by the NIH and hopefully will get renewed, fingers crossed, can really help narrow that down. So sort of any national plan around epilepsy for sure will help this community. So before we kind of jump into more of that empower and advocacy specific space, I know Medicaid is on the mind of a lot of our families. So can someone kind of update us where we're at now, what we know, what we don't know? I know that's a big question, but I would love for someone to really sort of try to help our families and community understand what's going on, because it's really hard to understand reading a headline, reading the paper.
I think to try to break it down in simple terms, what this resolution does is it creates a mechanism for Congress to change tax law and to change entitlement programs like Medicaid with a simple majority vote in the Senate. Typically legislation can be filibustered in the Senate and you need 60 votes to pass it. So basically what this means is that the majority in the House and Senate now just needs to keep their votes in line to pass anything that they want to do with Medicaid. They have different instructions for different committees in Congress of how to produce those savings. So really, the only thing they're really on the hook for is $2 billion to come out of either Medicaid or Medicare over a 10-year period. $2 billion sounds like a lot of money, but it's not that much money. The greater concern is that Congress will go beyond that. And there are members, particularly in the House. The House's original version called for $880 billion for in either Medicaid or Medicare cuts. And they're basically saying they're not touching Medicare. So it would have to come from Medicaid. This gets very complex. Politicians will tell you we did not vote for Medicaid cuts, but what they did vote for was a path to make it easier to cut Medicaid.
That's really helpful to know. Any additional kind of comments in that area? Because it is getting really confusing, and sort of I heard this, she heard that. And so it is helpful to know sort of the amount of money that's going to be cut and sort of where it might be more directed.
There's concern that there would be cuts to services that, actual services that patients uh, rely on for their care. Those who do have Medicaid, who do rely on it for their services, making sure that they're sharing, how important this is for their family, that this is a lifeline, that this is how they're able to access health care, that without it, they don't, many of these families have no idea what they would do without having access to Medicaid. And so I think it's making sure that members of Congress know that these are families, these are people working, these are people who have paid their taxes. These are, and without it, they would not be able to receive the care that they have been able to access to this date, and how that would impact real health outcomes. So I think that's probably the most important part, is just making sure that people are sharing this information with their members of Congress, because I think that there is maybe not as much awareness as people might think of who Medicaid is actually serving for members of Congress and their staffers.
Yeah, sometimes I think it's easy for them to want to cut things that they can't put a face to, or directly connect to a person or a story. And being on the Hill last week, the lines to get into the buildings were long down the block, and a lot of those folks in line and in the hall had big save Medicaid buttons on. Going to their offices, sharing the story about, I'm on Medicaid, and this is why I need Medicaid, and this is who I am. So I think that's really important. And even if you're not on Capitol Hill, any of us can pick up the phone and call our representative or call our senators, and ask them to support robust funding for Medicaid to keep those cuts from happening, and share the impact that Medicaid has on your life or your child's life.
Yeah, I'd love to pause a moment. I mean, I think this is something that, as I got more into the rare disease field, learning how important and just how much Medicaid can do for families. Can anyone kind of give a brief summary or kind of a list of all the things that potentially Medicaid is covering for many of our rare disease families?
I mean, one of the things that I think isn't thought about so much, but is the nursing care for their kids who need round the clock help and care. Without Medicaid, often that will go out the window. And so we already have families who, one parent stays up all night with their child, where that extra hand, that extra in-home care that comes in for 8 hours a day is hugely impactful. So that's something that I know a lot of the families that I've talked to really care about.
I'll also just kind of remind your audience that Medicaid is very unique in that it is a federal and state partnership. So really the federal government provides the funding to the states, and the states have to make the decisions about coverage, following federal guidelines, of course. But you may be familiar with the Medicaid waiver programs. A lot of folks with children with developmental disabilities take advantage of those programs, and it's different in every state, but in a lot of cases, it allows for in-home care. It provides coverage for in-home care for a child. So if you take that away, that has some very serious ramifications for our families.
Right. Well, one of the things that Shannon brought up kind of during this was really telling your story as a family. And so I think this is a perfect segue sort of into our second part, where we are talking about empowering our families to share their story, to really engage in that civil engagement process. I'd love to know how kind of each of your programs, or within each of your roles, how you're helping that, help families kind of engage and empower.
You really have to choose what's most important to you. So for the clients that I engage with and through my consortium, medical research is pretty far up on the list. And what we're asking our community to do, we have a very simple message for them, is to contact their members of Congress and ask them to restore the funding that was cut from CDMRP. We don't have a legislative vehicle yet. We're working on trying to get bipartisan bills in the House and the Senate. But for the time being, the message is restore the cuts. But I think the same thing needs to happen with Medicaid. It is really important at this pivotal moment when Congress is starting to put together what they call the reconciliation bill, which is actually going to have the actual specifics of where they want to have savings in entitlement programs and tax changes. That's where I think families really need to weigh in on the message that Katie mentioned about Medicaid.
Yeah. As part of my role with the EveryLife Foundation, working with patients from over 10,000 rare diseases, we really work to bring the community together because while there are 10,000 different rare diseases, many of those people are facing very similar challenges and barriers, whether it's to treatments or care, to diagnostics. And so we bring advocates together through two big events each year: Rare Disease Week on Capitol Hill here in Washington, D.C. in February, and then Rare Across America is our virtual in-district program during the month of August. And so those are two really big ways that advocates can come together to advocate. And I hear from so many advocates that they want to help on issues that don't even impact them, that have no effect on them or their diseases at all. But there really is this feeling of being a part of this bigger thing and that we're really all in this together. And so that's really something that we're working on, bringing advocates together and really having a voice for the community.
I love that, Shannon. I often, in the rare cancer work I was doing, we would always say rare isn't rare, right? Because there are so many rares that when you add them all up, it's really not rare at all. So that's an important message for our legislators. And for them, they really care. Their whole job is to represent their constituency. And so when you share your story with your member of Congress, what you're doing is you're tying it back, to their district, to their state, making sure they know that the impact of whatever the issue is, whether it's CDMRP research, whether it's Medicaid, is affecting folks, in their home state, in their district. And that really can bring it home for them. And you never know who, when you call an office or when you sit down and meet with a staffer, what that person's experience is. I'm always astounded when I, sit down with a staffer and they say, my sister has seizures, my cousin has seizures, my college roommate had seizures, and I had to learn, how to help him and what to be on the lookout for. So you would be astonished at how sometimes easily you can really, make that personal connection and connect the dots for someone who has a say in that policy space.
Yeah, absolutely. I can even share my own personal example of when I used to primarily work in the Fragile X syndrome, another rare disease field, and there was a Fragile X Advocacy Day that happened during Rare Disease Week, and being able to sort of share the story to one of our senator's staffers about kind of working at Cincinnati Children's and fighting in this rare disease space. He was like, oh, as a child, I was super sick. They didn't know what was going on. I was at Cincinnati Children's. This story is really meaningful to me. I'm definitely going to have to let the senator know. And so, yeah, I think it is sort of being able to connect those dots with people, on either side of the fence is really going to be really important. That being said, that was my second year doing that. And even still, I had a lot of nerves and anxiety. And, this advocacy, calling senators or representatives, is not something people do every day. And so, what's some advice that you can provide some of our community members of how do you get started? What do you say? It's overwhelming and, scary.
It can be intimidating if you've never done it before. And I will say that after the first time you do it, you realize how unintimidating it is. These are human beings that you're talking to, and like we said earlier, some of them may have connections to the diseases that we're talking about. Just remember that they're human beings. Don't hesitate to just leap in there and do it and tell your personal story. You do not have to be an expert on this incredibly complicated legislative process. But you are an expert on how your disease that you care about specifically affects you and your family. And that's what they're there to listen to.
Mhm.
And you, as Mark said, you're talking to another person, so you want to be respectful, you want to be polite, and I think one other piece of advice, and Mark mentioned this earlier, is to know what you're asking for, and to have your ask be something concrete. Whether it's don't allow Medicaid cuts, restore CDMRP funding, ask your boss to co-sponsor the National Plan for Epilepsy and Seizures Act, something concrete that you can conclude, your phone call or your email with. Be really clear about what you're asking for.
If you haven't done anything like this before, there's little ways to get started. You don't have to jump into the deep end of the pool. You can put your feet in, you can make a phone call, you can send an email. These are really just easy ways. They take a few minutes. Usually your organization or another organization like ours can help you with that. So it doesn't have to be a full-on travel to Washington, D.C., walk the halls of Congress, do the meetings. Of course, we love that, and those are very powerful. But don't feel like you need to do that as soon as you're starting out.
Yeah. We hope that we can get maybe some people from our community kind of involved in Rare Disease Week or Rare Across America in the future. And we'll definitely make sure our show notes kind of have some information about that. But I think it's really helpful that those emails and sign-ons or even phone calls are a really good place to start. One of the things that I've been thinking about, is sort of like, parents or family members getting discouraged of how is my voice really going to change anything, or how is my story going to impact? And so I would love if there is any good examples of kind of something recently where the family has shared a story that has impacted.
Yeah. I mean, we just had Rare Disease Week on Capitol Hill in February, and we had really amazing meetings where the senators were in the meetings taking meticulous notes for every constituent in the meeting about who they were and what rare disease they had. And I'm sure in the past, but it just seemed like this was just happening more than in years past. That definitely, we then saw, with the confirmation hearings that were happening after our meetings took place, that these meetings actually were having an impact on those offices, and they were asking questions about rare diseases and the impact, for instance, that these nominees could have on rare diseases. And there was one case where a senator asked the nominated CMS administrator about whether this family that she had met with, this man and this woman who had a child with a rare disease who depended on Medicaid for their child's care, and whether they should still be able to have access to Medicaid. And the nominee for the CMS role said that they should. And so while that seems really small, it's these little steps, these small moments that move the needle. And now the CMS administrator is on record as saying that a family with a child with a rare disease who depends on Medicaid for their care should, retain their Medicaid.
Yeah, I was on the Hill last week with Epilepsy's Action Network, and we did meetings with both staff and directly with members. And obviously when you meet with staff, they have to, run things by their boss afterwards before anything can happen. But I'll say that every meeting that we did directly with a member of Congress ended with that member saying, I will sign on to that bill. And that was a direct result of, a room filled with parents of a child with epilepsy, people who are living with epilepsy, a mom who lost her 4-year-old son to sudden and unexpected death in epilepsy. Like those are real stories that resonate, and ended, those meetings ended with that member signing on. And I'll share one other story. I worked with a mom in the rare cancer space who lost her 4-year-old son to a rare bladder cancer. And she was an incredible advocate for a bill that would require CMS coverage of multi-marker diagnostics when someone's first diagnosed with cancer. And she always brought like a sticker of an avocado, or she had earrings that were avocados because her son Finn loved avocados. And she met with the senator and shared the sticker, and she had her earrings. And when she did a follow-up meeting 6 months later, that senator remembered, oh, Finn and the avocados. Like sometimes those personal details really stay with a lawmaker, and they're important. So just to hopefully echo how important, each one of your stories is, and how that can really make the difference in a policymaker, choosing to support or to not support something.
I love that story.
I can share one last one.
Yeah, please do.
What happened last year? My client Cure HHT, as I mentioned, rare disorder. They have a Centers of Excellence program funded through HRSA. It's a very small $2 million program. The funding line usually comes through the House, but is never in the Senate bill. But last year we had a military family come from Maine. And they actually had a chance to meet personally with Senator Susan Collins. And she was so sort of taken by their situation and their story that she, pledged on the moment, like, I'm going to make sure there's a funding line in my bill. She's the chair of the Appropriations Committee. And sure enough, there was a $2 million line for the program in the Senate bill as well. That would not have happened without the difference that one person made.
Yeah, that's amazing. And, I do sort of, obviously these in-person conversations can have, a really profound impact. But I do want to remind our community that it doesn't have to be always in person, that phone calls, letters can also be really important.
And you can share photographs. You can,
Yeah.
attach photos to an email, if you can't be there in person, or if you have someone from your organization or an org like EveryLife who's going to be on the Hill, equip them with photos, because what we're really doing is tying this to real people with real stories, and that these policies have real impact.
Right, exactly. And we're talking to real humans too, which I think is also a really important point to remind our families. And I can't remember if it was Katie or Shannon who also mentioned really making sure when these stories are shared, tying it back to specific policies are going to be really important. So it's not just a story, it's a story that's going to be tied to Medicaid or, research funding or something like that.
Staff loves when you have a solution, when you're coming equipped to share your story and what they can do to help, when they don't have to try to figure out how they can help you, but you're telling them, puts it one step in the right direction.
Before we wrap up, my own curiosity, especially for our community members who are new to this, we've been telling them what to say and how to say it. Is there certain things they shouldn't say or avoid saying, just to make sure that their point is heard and taken seriously?
It's okay to be angry, right? But what you don't want to do is be belligerent and threatening in your meetings. You can express disappointment. You can say, in sort of the tone of voice that I'm using right now, Congressman, I'm really disappointed that you voted for these cuts to Medicaid or for these cuts to medical research. But give them a positive opportunity to fix it, and always be civil. Just let your passion come through, but try not to let your anger take over the meeting.
Great advice. Anyone else?
Yeah. I, like Mark said, that the tone is super important. I think keeping in mind that you're trying to build relationships with these offices and with these staffers. This isn't just a one-time interaction. Hopefully this is an interaction that you're having, yearly, if not, 2 or 3 times a year, where hopefully you're building a relationship where a staffer can contact you when issues are coming up and ask you, hey, how does this impact your community? How would this impact your family? Like, that is the ultimate goal, I would say, of meeting with your legislators and their staffers. So you definitely don't want to close doors or burn bridges in your meetings. I would also say, as a former staffer, it would be really interesting how many people walked into the office with a preconceived notion. But I think that walking in with an open mind, that you might get an answer that you're not expecting, I think can help make sure that the meeting is tone is maybe a little bit more positive.
I love what Shannon just said about being a resource for your member of Congress and for their staff. I think sometimes we forget that members and their staffers have an entire portfolio. Like they have to know everything or policy make on everything. And so you may be, equipped to be a true resource, or your organization, be a resource for members in that certain policy area. That's a relationship you want to establish. And the more that you can be, or your organization can be a resource for a member on that particular policy area, that's fantastic. That gives you a true opportunity to shape policy.
One last thing to add that I just thought of. Don't ever
Yeah.
suggest cutting research for one disease to pay for the disease you hear about. Don't say,
Yes.
well, breast cancer gets all this money. Why don't you just take 5 million from that and shift it over to Phelan-McDermid? So that will get you nowhere.
That's a good point. And you can say, look at all this federal attention to breast cancer. Look how it's innovated this disease.
Mhm.
Look how it's made progress for patients. We need the same for,
Right.
X. But yeah, you're right.
I think the other really important thing that I like that was pointed out is that just because a representative, senator kind of did something in the last vote doesn't mean they're going to do it again on the next vote. And sort of there's this chance to do something different. And so I think that's also something, sort of keeping that optimism or hope alive. And again, these stories can change people's minds. And so I like that message for myself, but also for our community. That there's still things we can do on the Medicaid front. There's still, you guys are already talking about the 2026 fiscal year, and so like making sure we have the medical research funding in there again. I know I could be here with you guys for another hour, but I also know you guys are really busy and you have very important things to do. But before I do let you go, any sort of last parting wisdom or ideas you want to share with our listeners at the Phelan-McDermid syndrome community?
I would just say thank you for being interested in advocacy. Now it's more important, than ever to be an advocate and to be sharing your story. I think sometimes things can feel complicated or feel depressing, and it might be tempting to just bury your head in the sand, or to say, I'm just me. What kind of impact can I have on this? But as I think Shannon said, together our collective voice is very, very powerful. And it's the tool that we have to shape policy. So it's really important that we're using it at this particular time.
And thank you for having us talk about advocacy. And if this is of interest to anyone listening, we would love to have you join us for Rare Across America this August. We schedule the meetings for you. They're virtual or in-district, in-state meetings. And we provide all the webinar trainings, and all you have to do basically is show up to your meeting. So if you're ready to kind of stick more than your foot in, this is a really easy way to do it. And I would just invite you to join us. You can learn more at rareacrossamerica.org, and registration for that will open in May.
Awesome. We'll make sure to include that in our show notes. And that was my first part of advocacy in 2021. And I was scared, but it was an amazing experience. And it motivated me to then be able to go on the Hill. So I definitely encourage family members who are just sort of thinking about it. It's a great sort of like initial first taste to see what it's like.
I would just add, certainly want to echo what Katie and Shannon said. I think it's easy in this environment to be discouraged and to feel like government is not there for you. But it is more important than ever that normal, everyday citizens be engaged in what is happening right now. This is in the 40 plus years that I've counting my Hill experience and my advocacy experience, I've never seen anything so consequential that really affects people's lives directly of what's happening in Washington, D.C. So it is more important than ever to be engaged with your members of Congress.
That's a great last parting words. Well, thank you again, Shannon, Mark, and Katie. I'm so grateful for you guys who've taken time out of your schedules to be here and to talk to our Phelan-McDermid syndrome community. And, as we've said a couple times here, everything you've talked about today is not just unique necessarily to the Phelan-McDermid syndrome community. It's across rare diseases. And so, I hope this message can also be heard in other rare disease communities as well. There was a lot we talked about today, and so I'll make sure we have a nice show notes as well as a blog post that follows up. And I'm excited for kind of the next steps and to hear people's experiences now. Thanks all.